High blood sugar can affect anyone, whether you have diabetes or not. Most people think of blood sugar spikes as something only diabetics deal with, but the reality is that when glucose levels rise sharply in the bloodstream, the body reacts quickly. You might feel thirsty, tired, dizzy, or notice that you're using the bathroom more frequently than usual. For people living with diabetes, however, high blood sugar, also called hyperglycemia, is more than just uncomfortable. It can become dangerous if not addressed quickly. That's why understanding how to lower blood sugar immediately using safe and doctor-recommended strategies is so important. Before we go deeper, make sure you like this video and subscribe to our channel for more science-backed health insights. And don't forget to check the description box for all sources and references used in this video. Hello, I'm Dr. Justin Whiteman. I analyze the latest research on blood pressure, diabetes, and cardiovascular disease, translating complex scientific findings into clear, practical insights through educational video content. Today we're going to explore what doctors say about quickly lowering blood sugar, why spikes happen, and when it's time to seek medical attention. Let's start with how to recognize high blood sugar in the first place. The most reliable way to know your blood glucose level is by using a glucometer, a device that measures sugar levels in a small drop of blood. But many people also notice physical symptoms. According to endocrinologists, when blood sugar becomes very high, the kidneys try to remove excess glucose through urine. This process pulls water from the body, which is why people with high blood sugar often feel extremely thirsty and urinate more frequently. Some individuals also report dizziness, tingling sensations in their hands, fatigue, or an unusual lack of energy. In more severe cases, symptoms can include nausea, vomiting, abdominal pain, or confusion. Over time, if blood sugar remains elevated, it can lead to blurry vision or unexplained weight loss. Doctors emphasize that persistent high blood sugar should never be ignored. In the short term, extremely high glucose levels can lead to serious conditions such as diabetic ketoacidosis or hyperglycemic hyperosmolar syndrome, both of which may require hospitalization. Over the long term, uncontrolled blood sugar can damage blood vessels and nerves throughout the body, increasing the risk of eye disease, kidney failure, nerve damage, foot complications, and cardiovascular problems. So what should you do if your blood sugar spikes? One of the most effective immediate strategies for people with diabetes is correcting missed insulin. Insulin is a hormone naturally produced by the pancreas. Its role is to move glucose from the bloodstream into cells, where it can be used for energy. When insulin levels are too low or absent, glucose remains in the blood instead of fueling the body's tissues. If someone misses a dose or their insulin pump malfunctions, blood sugar can rise rapidly. Restoring the proper insulin dose helps shuttle glucose back into the cells, lowering blood sugar levels. Another common issue is missed medication. Many diabetes treatments are designed to be taken on a strict schedule. If a dose is skipped, blood glucose can increase. Taking the missed medication may help bring levels down again. However, doctors caution that most medications, such as metformin, work gradually and are not meant to be taken only when blood sugar spikes. They are part of a consistent treatment plan rather than a quick emergency fix. Hydration also plays a critical role. When blood sugar is high, the body tries to flush excess glucose through urine, which leads to dehydration. Drinking plenty of water helps replenish fluids and supports the kidneys in removing excess sugar from the bloodstream. Importantly, doctors advise avoiding sugary drinks or juice during a spike, since those can raise glucose levels even further. Physical activity can also help lower blood sugar quickly under the right conditions. Moderate aerobic exercise, like a brisk 20-minute walk, encourages muscles to use glucose as fuel. When muscles burn glucose for energy, less sugar remains circulating in the blood. Research shows that even a short walk after a meal can reduce blood glucose levels significantly. However, this strategy only works safely if insulin is present in the body. If someone is approaching diabetic ketoacidosis or feeling severely ill, exercise could actually worsen the situation, so medical guidance is essential. Understanding why blood sugar spikes occur in the first place can help prevent future episodes. One of the most common triggers is diet, especially foods high in simple carbohydrates. Items with a high glycemic index, such as white bread, potatoes, or refined rice are broken down rapidly by the body, causing a sudden rise in blood glucose. Other causes include missed insulin doses, malfunctioning insulin pumps, or insulin that has been exposed to heat and becomes less effective. Illness can also trigger elevated blood sugar levels. When the body is fighting infection, like a cold, flu, or stomach bug, stress hormones are released, which can increase glucose production in the liver. Certain medications, including steroids, some antipsychotics, statins, and beta blockers, may also raise blood sugar as a side effect. Stress and hormonal changes are additional factors. Emotional stress activates hormonal pathways that increase blood sugar, while some individuals with type 1 diabetes notice fluctuations related to hormonal cycles. Finally, it's important to know when to seek medical care. Anyone experiencing severe symptoms, such as persistent vomiting, severe abdominal pain, confusion, or difficulty thinking clearly, should contact a doctor immediately. People with type 1 diabetes are often advised to carry ketone testing strips, since the presence of ketones in urine can indicate diabetic ketoacidosis, a medical emergency. If blood sugar remains high despite insulin, medication, hydration, and other usual care steps, professional medical help is essential. Managing blood sugar effectively requires awareness, consistency, and quick action when levels rise unexpectedly. By recognizing symptoms early and using proven strategies like proper medication, hydration, and safe physical activity, many spikes can be brought under control before they become dangerous. If you found this information helpful, make sure to like this video and subscribe to our channel for more evidence-based health insights. And remember to